Unexplained abdominal pain. As an allergy immunology doctor, it's super common for me to see people with GI symptoms that think that food is causing their problems. And honestly, often they're not wrong. In the last few months, there was a new clinical update released by the American Gastroenterology Association speaking about screening for alpha-gal or meat allergy when people have unexplained abdominal issues. This is a unique allergy because it's one of the few allergies where a tick can cause the allergy. Essentially a tick called the Lone Star tick, which is available in the southern states and part of the Northeast. You get bit by this tick and you start developing an allergy to mammal meats like 2 weeks later to 4 months later. You can't trust the history of the tick bite because often the person doesn't remember that they were bit by a tick in the first place. Now, symptoms are similar to other allergies. You can have hives, some people can have anaphylaxis, they can have nausea, vomiting, diarrhea. But what's interesting, and they quoted in this study, is that in a GI clinic where they did open challenges to these people, 40% of them only had abdominal pain as their symptom. And that abdominal pain went away when they went on a meat-free diet. Now the symptoms are delayed, so it's sometimes hard to keep up with what you just ate. Meaning you could have had meat for lunch and the symptoms start at dinner time while you're eating dinner and you're like, what am I allergic to in my dinner? But actually it was in your lunch because the symptoms are about 2 to 6 hours later, which is abnormal for a food allergy. Typically food allergies cause symptoms within half an hour. Because this is a carbohydrate, it appears to be absorbed linked to a fat and then it kind of dissipates from the fat later on, and that's why it causes the delayed reaction. Now, alpha-gal is found on mammal products, so that means the person needs to avoid beef, lamb, pork, and often dairy is also bothersome to them. So they might have to avoid butter, lard, and cheeses as well. Some people improve over time and are able to reincorporate dairy later into their diet. If you have unexplained abdominal pain, there's multiple causes that it could be, but if you're having a hard time finding a diagnosis, it might be worth seeing an allergist and getting a blood test for alpha-gal, especially if you live in an area that has the Lone Star tick. Alright, hope that helps.